Despite growing pressure from doctors and scientists to abandon the relaxation of COVID restrictions over Christmas, the 4 nations of the United Kingdom have broadly agreed to stick to the plans, albeit with adjustments in Wales and to a lesser extent in Scotland. With the number of infections rising sharply, all 4 nations have decided that people should be urged to show extreme caution over the 5-day period. Well, the rules initially agreed for all of the UK between the 23rd and 27th of December allow 3 households in a so-called Christmas bubble to mix indoors and to stay overnight, but only if that is unavoidable. Wales now wants to limit the mixing to 2 households, but those households can be joined by a single person who lives alone. Non-essential shops will close on Christmas Eve, and all of Wales will return to a form of lockdown on the 28th of December. Scotland is urging that any interaction with other households should ideally be outdoors and that contact should be limited to 1 day. We'll be looking at the Christmas plans after today's revisions and how effective they're likely to be. We'll start with this report by our political editor, Laura Kuensberg.
Even sorting the tree hasn't seemed straightforward this year. Politicians gave a promise we'd be able to gather together at Christmas, a glimmer of light at a grim time. But along with gifts, new concern about the virus is arriving in number 10. So permission to see friends and family comes with stern new advice.
We're keeping the laws the same, but we all want to send the same message. A smaller Christmas is going to be a safer Christmas, and a shorter Christmas is a safer Christmas.
You are still allowing a 5-day period to go ahead when people from all over the country will be able to get together. Wouldn't it now be safer, clearer, and perhaps braver to ditch the plans to relax the rules over Christmas?
We don't want to, as I say, to ban Christmas, to cancel it, and I think that would be frankly inhuman. What we are saying is that that guidance, the 3 households and the 5 days, that really should be regarded as a maximum. But we're also relying on people's strong sense of personal responsibility.
Leaders around the UK have tried to stick to the same approach. There will be some limited extra freedom over the festive period. In Scotland, where soon 80% of people will be living under tougher restrictions. But there'll be no huge knees up for mother and daughter Mags and Louise Livingston.
We come from a really big family, so normally we have a huge Christmas, loads of games, lots of drinks, lots of partying, all the kids, but this year obviously it's completely different for us.
The Christmas relaxation of the rules will go ahead, but with a similar call for caution.
I have to say I hate with every fibre of my being standing here trying to regulate how you spend Christmas. The reality is that this Christmas simply can't be normal, but we have every reason to hope that next year's will be much more normal.
The picture's bleaker in Wales, though, where the law is being tweaked so that only 2, not 3 households can get together. In Carmarthen, plans are already changing.
We had 3 households together, but I think it's just going to be us now. So the numbers are increasing as well, aren't they, at the moment? So it is a worry.
Pressure's intense on the health service. And with the spread of the disease, Wales is going back to a limited lockdown straight after Christmas.
Nobody wants to be ill at Christmas, and none of us want to give this deadly disease to our closest family or friends.
In Northern Ireland, winter illness conspired with COVID to fill hospitals to bursting last night, leaving ambulances queuing with patients inside for as long as 12 hours. And that's even before any of the rules are eased up. No surprise, politicians here are telling people to take care too.
Be risk aware at all times. Remember the situations and activities that help the virus spread. So keep your distance, stop your contacts with others outside your household or Christmas bubble.
The political decisions about Christmas were never designed to create a free-for-all. But the worsening pattern of the disease has forced a rebrand, if not a rethink. Some families in Essex today were worried about the consequences.
What's going to happen is it's just going to spiral out of control again, and I do think they're wrong for doing it.
I think it's too late now. I think people have made their plans, and I think if they come in now and they change it, people are just going to do what they were planning to do.
Politicians must balance the dangers from the pandemic with the real cost to so many other aspects of our lives. This year, what's meant to be a time of celebration is a time of real risk too. Laura Kunsberg, BBC News, Westminster.
So as we've been hearing, the approach in different parts of the UK has changed somewhat today. So let's visit Scotland, Wales and Northern Ireland to find out more. In a moment, we'll hear from James Shaw in Glasgow and Emma Vardy in Lisbon. First, we're going to join Sian Lloyd in Cardiff.
Here in Wales, tighter restrictions are on their way. Non-essential shops and close contact services such as hairdressers, together with fitness and leisure centres, must close from the end of trading on Christmas Eve. And all hospitality venues must shut from 6 o'clock on Christmas Day. Now, the 5-day Christmas COVID window that had already been agreed remains in place, but the Welsh Government have told people here that they can only form a Christmas bubble of 2 households by law, although a single person can join them. From the 28th of December, Wales goes into lockdown, which means people are expected to stay at home and public facilities will close. There's no end in sight to these restrictions, but we are told they will be reviewed every 3 weeks.
Here in Scotland, the restrictions around Christmas are already a little tighter than they are in other parts of the country. So only 8 adults from 3 households should meet indoors. That total doesn't include children under 12. But the guidance today limits even more what people are supposed to do. The Scottish Government says that you should only meet on one of the 5 days of Christmas. The amount of time, the number of people involved should be as small as possible, and you should not stay in someone else's house unless it is absolutely necessary. Also, travel between high risk and low risk areas should be avoided.
The location of us here in Northern Ireland means that people have been given an extra couple of days for travelling over the Christmas period. So people told they may travel to and from Northern Ireland between the 22nd and the 28th of December. A narrower window though for that Christmas bubbling. People are allowed to meet up with other households between the 23rd and the 27th of December, and it's up to 3 households that are able to form a Christmas bubble. Now, for those heading out for some Christmas cheer, pubs and restaurants that serve food here are still allowed to stay open for now, but there is still that limit on opening times, which here in Northern Ireland is 11 o'clock. But saying that, there is still a lot of concern here about high numbers of cases. Recent restrictions haven't had the kind of impact ministers had been hoping for, so there's still the possibility of further restrictions on hospitality to come.
Emma Vardy there, ending that sequence in Northern Ireland. Let's have a look at the latest government figures on coronavirus. They show another 25,161 cases have been recorded in the latest 24-hour period. It means the average number of new cases reported per day in the past week was 20,923. 1,662 people were admitted to hospital on average each day over the week to last Saturday. 612 deaths were reported for the past 24 hours. That's people who died within 28 days of a positive COVID-19 test. On average in the past week, there were 422 deaths per day, and the total number of UK deaths so far is now 65,520. So with me in the studio is our health editor, Hugh Pym. And Hugh, let's go back to some of the reasoning and the anxieties being expressed during the day by experts on the easing of these restrictions. What can you tell us about the level of anxiety?
Well, Hugh, if you look at the detail of some of that data we've just been reporting, we discover that more than 18,000 patients with COVID-19 are now in UK hospitals. That is the highest since April, and getting close to the peak then of 21,000, and compares with just 800 in early September. That's a stark illustration of the way pressure's been building up on the NHS. And we heard from Professor Chris Whitty, the UK government's chief medical advisor, at the briefing today that any kind of mixing of people that wouldn't otherwise have happened will result in higher risk, more cases, more people going to hospital, and sadly, some of them not surviving. In other words, what will happen over Christmas? The British Medical Association has said today relaxing the rules will cost lives, and people must think very long and hard about what they do over Christmas. Though we should add that health officials also acknowledge the benefits of some mixing in terms of people's well-being and mental health, and those who are lonely. Tonight we've learnt from Public Health Wales that 11,000 extra positive COVID tests have been discovered in the system relating to the week ending on the 15th of December, in effect doubling the number that were known about. Now, we've seen one or two problems in other parts of the UK, including England, of test results being delayed and coming forward, but it comes at a very sensitive time. In Wales, there have been calls for reassurance for the public that a grip has been got on this situation, but it may actually reinforce the Welsh Government's argument for these tighter restrictions over Christmas.
Hugh, many thanks again. Hugh Pym, our health editor there.